Hi, this is Dr. Kathy Verhusen. I am recording the video for week 12. I apologize that it is a little late. The week kind of got away from me, as it does to all of us, right? So that's the reason I try to be very compassionate to what you're going through. And so I'm going to share my screen right now, and we'll get into this. Okay, I'll just make this into a presenter mode. There we go. Okay, so this week we're going to talk about the care of vulnerable populations, part 2. Last week we talked about those who were vulnerable in other populations, such as victims of violent crime and incarcerated inmates. Now we were going to talk about homelessness, mental health issues, and addiction and alcoholism. And there are a number of ways these things interplay with each other. So many people who are homeless or who have inadequate shelter do suffer not only socioeconomically from being in poverty, but many also suffer from untreated or mental health issues, and sometimes they self-medicate with alcohol or with illicit drugs, and so we'll talk a little bit about that as we go on. So I want you to take just a few seconds and think about, if you were homeless, what health risks do you think you would have? Take a few minutes. If you were in class, I'd ask you what your responses were, but since we aren't, we'll go through this. The homeless are at risk for a lot of health issues that you and I who have shelter over our head are not. One being hypothermia during the winter months, and hyperthermia or heat stroke during the summer months. So they might have frostbite, they might have their core temperatures drop. I don't know if you've sat on concrete for any length of time, either when you were younger or watching a parade, or when you're out with friends and you're just kind of hanging out. But concrete can get very, very cold. And many times homeless people are not sleeping in their cars. They're actually sleeping on the street, and they're sleeping on sometimes garbage bags, sometimes a very thin blanket, sometimes nothing at all. And they're just napping throughout the time. And so they really are out in the elements and at risk for those things. They're also at risk for chronic diseases and acute diseases or infections happening because they don't have adequate medical care. And so one of the reasons they don't is on us, the medical professionals, because many times they'll come in to the emergency room and they'll actually be treated quite poorly. People will have their own biases on why someone is homeless. And, you know, that kind of old mentality of pull your bootstraps up and just kind of get out there and get a job and what, you know, rather than understand the complexities that lead someone to being homeless, which can be loss of a job or inability to pay bills, like I said, untreated mental health conditions such as schizophrenia, depression, anxiety disorders that lead to broken relationships with friends and family, that lead them sometimes to escape to other areas. There are a lot of complex issues at play when someone is homeless. It's not as simple as going out and getting a job. For one example, when you go for a job interview, you need to be clean and well-dressed and presentable. And many times people who are homeless don't have that luxury to be able to do that. Okay, one of the other risks that you can run into is victims of violent crime, like we talked about last week. You have no walls to protect you from someone at 2, 3 o'clock in the morning, or some even like at 9 and 10 o'clock in the morning that are walking around just looking for somebody to beat up. And I'd say, I don't want to say that flippantly, but if you open any news article on it, even over the last 2 months, you'll find videos of people just walking down the street and getting attacked, let alone someone who's actually on the sidewalk day in, day out, sometimes begging for a sandwich or for some money. So I think that there's a lot of health risks that they run into, and a lot of them that are left untreated. For our overview, there's over 100 million homeless worldwide and another billion without adequate housing. And adequate housing is really an issue. It affects the health because of poor physical housing conditions, but also the fact that we just don't have enough affordable houses or living dwellings within the United States. And sometimes the location of the housing where it's put is unhealthy in itself, either environmentally or by high crime rates or things like that. If the world were 100 people, I asked you to watch that video this week, and I certainly hope that you did. 77 of us would have shelter, but 23 would not. An astounding almost a quarter of the people in the world don't have adequate housing. And we see this in other countries when we see disasters happen, and we'll see entire areas just devastated by this disaster because housing was not built to code, because they couldn't afford to build it to code, and those types of things. But even here in the United States, we have a large population of homeless individuals, and it is growing dramatically on a daily basis. I also asked you to watch a video that talked about homelessness in higher education, those students who are in higher education, such as yourself. And so this statistic is just amazing. A third of post-secondary learners expressed insecurity about housing, and 9% identified themselves as homeless. And so you may indeed have people who are in your classes that are barely able to get by, and you may not know that they are not going home to an apartment or a house every evening. They are indeed going to a homeless shelter or to their car in order to make it through school. And so I think just like anything else, many times these things are hidden from us unless we're looking, unless we're really paying attention to those that are around us. What's very interesting is that homelessness in the United States is now seen as such a major health risk, because you take why somebody has something and then you go back in time as to what caused that. So somebody may come in with a gangrenous toe, and that's why are they here with a gangrenous toe? Well, they have untreated diabetes. Well, why do they have untreated diabetes? Well, because they can't afford their insulin and they don't have any insurance. Why can't they afford their insulin or have insurance? Well, they don't have any job right now. Why don't they have a job? Well, they have some issues with drug addiction that are untreated, and they are homeless. And so we go down that road, and we find that a lot of times, if we can help people get into adequate housing, it can help them then seek that medical care that they need and get them off the street. And I will tell you that a minimum wage worker, which in the United States is $7.25 right now, that's minimum wage. You could work 40 hours a week, minimum wage, full time. You could even work more than that. You cannot rent a 2-bedroom apartment anywhere in the United States. And what's tragic about that is if you have any children, most municipalities are going to ask you to have a 2-bedroom apartment or require you to have a 2-bedroom apartment. And if you have children that have 2 different sexes, boys and girls, they'll ask you to have a 3-bedroom. And that's even more laborious for these people to be able to get. So housing is really important. And what's interesting is that now communities are coming together as healthcare providers, such as 3 or 4 hospitals within a community are coming together, and they're starting to build affordable housing as a way to reduce the health risks in the community, and they're improving health outcomes. And so I know this is happening around the country. We had some discussions on it in class where people have said, yeah, in my community, they decided to do that. And we've actually had a real decrease in the health risks and the cost of healthcare in our community by just getting affordable housing for people. I want to switch right now to mental health. And mental health is really a state of flourishing. It's not an absence of mental illness. For years and years and years, we thought that if someone was lacking any mental illness, they must be mentally healthy. And in some contexts, that makes a little bit of sense. But actually, the discipline of positive psychology, which started about 20 to 25 years ago out of the University of Pennsylvania, it really talks about, well, it's not really that kind of this level of mental health and then things below that are mental illness. Let's look at that entire spectrum and say, what is mental flourishing? How do we get people to flourish mentally with a positive outlook, with high levels of psychological and social functioning within society? As opposed to that, the state of mental illness is thought of as languishing. So those are opposite words, flourishing and languishing. Languishing is characterized by feelings of emptiness, stagnation, you're stuck where you are, nothing you will do will make it any better. And there were also specific symptoms that would be along specific lines of mental illness. And many of these can be treated with therapy, cognitive therapy in particular, and also with medications. I know several people in my own family who suffer from mental illness, and we talk about how the medications help them. And like I said, sometimes when people who have mental health problems, they start feeling better, they don't want to take their medication because they would like to be like everybody else, right? Don't we all want to be like everybody else? And but we talk about certain chemicals perhaps being in balance in the brain or lacking in the brain. This is particularly true for schizophrenia, where people hear voices. Many times medication can take care of that and silence those voices or quiet them. And there is no doubt these people are hearing voices in their brains. That's exactly what is happening. But we can help them with that. So mental health promotions for public health should really center on these areas. And I'm not going to go through all of them, but one of them I'll pull out is like work-related stress, right? So I can also relate that to school-related stress for you guys. Work-related for me, school-related for you. We're going through COVID right now, and nothing is normal, and everything is kind of stressful. And we're adding that, and it's going on and on. And when we thought it was going to be over, it's actually spiking, and we aren't able to go out and see our family and our friends like we want to. And this stress can really, really cause us to have these temporary bouts of mental or behavioral issues. And we might be suffering from temporary or an exacerbation of depression. That's just normal for what we're going through. And so those are the things that public health nurses want to focus on to help people with. Treating mental health in the community, this was obviously pre-COVID, but depression can affect anyone. It hits ethnic groups more heavily, though, because the poor often have less access to quality health care. And we've talked about that cycle before, how certain ethnic groups have less access to health care, and there's many reasons for that. But treating then mental health in the community is really important. Behavioral health within the community is a rising field. There are more and more people being involved. Realizing that those episodic times when someone actually goes to a provider and seeks help, which may account for 1% of their entire lives for that year, the time that they actually are seeking help, that there's 99% of time that's out in the community and they need help out there. And so behavioral health out in the community is really rising. Substance abuse, again, very interlaced with this. We know that there are drugs right now out on the street, heroin for one, that someone can get addicted to it. This is scary, right? Addicted to it the first time they try it. So no longer can there be a mentality of I'm just experimenting with some drugs. And I understand that. I understand that mentality, but it's so unsafe right now with the high content that they have in some of these drugs. And the reason for that is financial. The person who's supplying the drug to the person who's supplying it to the user is making them more potent, so they're easier to be addicted, so that they get their clientele hooked. That's exactly what this is about. This is financial, is what this is about. Prescription drugs used in an illegal manner is also on the rise. So when people bring home oxycodone or Darvocet or Percocets, those things that can be addictive, even the drugs that treat like a hyperactive attention deficit disorder, right? Those things can be used to help someone have a sense of being elated or euphoria. And also hallucinations. And so those need to be secured and disposed of in a reasonable way when somebody isn't using them. For example, when my father passed away, I went through all of his medications. I then bagged those up. I took them to a prescription drug disposal unit that was actually at our police department. They have a very convenient way for me to get rid of those. It's not dumping them down the toilet or opening them up and putting them down the drain. If you work in an acute care setting, you may actually have jugs to get rid of ones that perhaps are the end of a prescription that patient brought into the hospital, they're no longer going to use, and it's like filled with a charcoal gel. But they will, when you work in an acute care setting, they'll let you know how to get rid of that medication. Sometimes they go back to pharmacy, but sometimes there's things that you can use actually in the med room. I know we kept ours underneath the sink, and you would just unscrew this top and you would pop pills in there or inject the medication in there, and it would be safely disposed of. Alcohol, we know that can be overused, and you do have an activity this week dealing with alcohol. And tobacco, another thing. So how much does it cost for a pack of cigarettes right now? $8-9 a package, depending on which brand you smoke. For those of us that don't smoke, I had to really look that up. I didn't even know. I asked the class. I don't know how much cigarettes cost, but they're about $8 or $9 a pack. Many people who are addicted to smoking, particularly homeless individuals, particularly people who drink or use drugs, go through at least a pack a day, sometimes 2 packs a day. Think of that. Let's say we round it to $10. $10 a day, $300 a month just to smoke something that's very bad for your health. Now, the average person, I've read throughout all of my studies, the average person who needs to quit smoking actually quits 16 times before they're successful. So if you have loved ones or you have patients and you're encouraging them to do a smoking cessation program, let them know that just because they've been unsuccessful in the past does not mean they need to be unsuccessful in the future. So these are the determinants of health. I just wanted to review these. We hadn't touched base on them for a while. So these are a group of questions you could ask. There are many, many questions you could ask, but these are just examples that you could ask someone if they were in a homeless situation, or if they were using they were abusing substances like drugs or alcohol. So you might ask them to understand their psychological determinant of health. How's your self-image? Well, how do you feel about yourself when this is happening? Environmentally, how accessible are drugs within your area? I know when I was working at the maternity home, sometimes we would have new moms come in. They'd want to stay with us. They'd have to go through a drug screen. I'd do the drug screen. I'd screen for about 6 drugs. I'd come out after about 2 or 3 minutes to do the drug screen. And I'd say, oh, you tested positive for, marijuana. And they'd say, oh, I don't smoke marijuana, but you know what? Everybody in my house does. And so there it is, right out there, secondhand smoke of marijuana causing a positive marijuana test on a pregnant woman. So how accessible are they in the area? How accessible are they in the house? Is it the norm for her or his network to use drugs? Is this their group of friends? And what are the attitudes as health systems? What are the attitudes of providers towards people who have substance abuse? I will say, again, check your biases at the door. Do not bring your own personal biases into the workplace when it comes to taking care of your patients. You don't know their story. You haven't walked in their shoes. I would say that you should have a Christian view for everyone that you take care of as if they were Jesus, and you love, love, love on them. And you do not hold a bias against them just because they're using illicit drugs. So somebody comes into my ED and they've got kind of the facial sores that you get when you're addicted to meth, because what happens when you're addicted to meth is as you start believing that you have insects under your skin gets very itchy. It's toxic, of course, and you feel like you have insects, and so you start scratching it yourself, and that's what causes all these. They're little pick marks, really. And so somebody comes in my ED, and let's say they're coming in for something else, but I'm suspecting they're a meth addict. I am going to treat them with the utmost respect like I do everybody else. And I want to figure out, can I help them with this? Likelihood is in an ED visit, I might not be able to, but maybe once out of 100 patients I see, maybe I'll get through to them, right? I think whenever we care for someone who is addicted to drugs or alcohol, we are a link in a chain. And so you never know what your impact may be. So you might have that talk with them about the resources that are available. They may say, they may blow you off, but it may start the wheels rolling the next time they're having a hard time and say, you know what, they said I could call this number and they would help me. And so always make sure that you reach out to them. These are just some of the Healthy People 2020 goals. Again, we're going into the Healthy People 2030, although you'll see those on some sites, but not all of them. But we really do want to decrease driving while under the influence. That's a big one. Number of adolescents who have engaged in binge drinking or marijuana or cocaine use. Binge drinking, I'll tell you, when I lived in Waupun, we had a student who just graduated from high school the year before, had gone off to college, came back his sophomore year, and he had his birthday at home, and he went out binge drinking with family members and friends, and he ended up dying from binge drinking. I think he did, what, 21 shots of Everclear is what they said. And that's just nasty stuff. But binge drinking has claimed a lot of lives. We tend to think that that's okay, that drinking on the weekend or whatever is a way to unwind and those types of things. But the binge drinking can really harm people, can really cost them their lives. All right, so your assignments this week, which you may have already finished, but I just want to kind of go over them. Public health clinic, just submit that just like you did before. Get an 80 on the quiz and submit a screenshot for me. The reflection paper, how does caring for vulnerable populations reflect your worldview? Think back on classes that you've had in the past. And then alcohol on campus is your after class activity. If you need any extension on any of these, just let me know. I realize I got this video up late. Okay. All right. I think that is it. I'll stop sharing, and I will ask you to have a great weekend. Bye-bye.